Great. Greetings, everyone. This is Sandy Herrick. I'm a licensed resident in marriage and family therapy in the state of Virginia. I'm also a psychoeducation provider, a life coach. I wanted to share with you today what is specifically is a marriage and family therapy provider. In general, marriage and family therapy providers have received training in diagnosing and treating mental health conditions that appear in the Diagnostic Statistical Manual known as the DSM. They call it DSM-5/TR for text revision. Some examples are depression, bipolar, anxiety diagnosis, ADHD, schizophrenia, substance use disorders. Um, the setting could be outpatient clinic, through a community mental health agency, a hospital, or other inpatient facilities, a substance abuse clinic, etc. Yes, you may find us anywhere where diagnosing and treatment of the diagnosis through psychotherapy is needed. So the key difference between marriage and family therapy and many other types of therapy is the approach to the therapy in itself. This approach that marriage and family therapy providers use will involve multiple individuals at times, hence the marriage and family part of the discipline. But this is also true when the individual comes alone to therapy. It's just that the others are not there physically to attend the services. They're there in the conversation with the individual. But the context of the individual's various relationships where the distress of the diagnosis symptoms present always comes to the session. So this is what we call a systemic approach to psychotherapy. That is to say, we help to examine the context of the various systems around the individual, the impact of the diagnosis in the severity of the symptoms the individual is experiencing challenges with, as well as the impact of the system in these symptoms. So, as mentioned above, a couple or family participates in therapy together and for mutual benefit. So everybody's in agreement. We want to figure out what we need to do. Uh, Now, when we only see the individual alone, the individual is able to see benefits in understanding their adversities in terms of their role and the role of the others in the various relationship contexts that they're involved in, whether in their past or in current relationships. This in turn is going to benefit the individual in the management of this past, current, or even future relationships. Now, very important, the marriage and family therapy provider is not responsible to repair marital family discord. Instead, through the use of research theory-based protocols and therapies, the individuals or the couples or the families are supported in resolving these discords while recovering from the challenges and impairments in functioning associated with the symptoms of the diagnosis, which, dare I say, are primarily impairments in relational functioning. These theories-based protocols and therapies focus on empowering the individual to effectuate their own internal and some external changes needed to improve their functioning, relational functioning is what I mean, in the various relationship contexts they may find themselves on a day-to-day basis. Yes, I'm saying that the distress that happens to that individual in their closer relationships, they're experiencing the same version, just to a smaller degree or scale in other contexts. So it is the same distress at home with my spouse, but I'm somewhat experiencing that distress at work, just at a different level. The stakes are also different. My body of work, both clinical and psychoeducationals, are couples with no active affairs or active substance abuse. We will discuss this. We will put them in the context of the systemic impact, as long as it's not active, either the affair or the substance abuse. That's because my practice, that's not my audience. If I was in a substance abuse clinic, that will be my audience, but it is not at the moment. Um, the next one is families with challenges associated with acting out behaviors of any of the family members, with the exception of substance abuse for the adults and affairs for the adults. Families with co-parenting challenges causing distress in the family system of the individual, systems, I should say, or families experiencing a family member autism spectrum disorder or attention deficit hyperactivity disorder presentations or deficits. And finally, the third area, my third type of audience that I clinically and psychoeducationally focus on as part of my audience are individuals with trauma, providing trauma-informed psychotherapy, including availability for body-mind approaches for intervention. If you want to learn more about these three areas that I focused my practice, my niche, or I can support you in your mental health recovery, please contact me through the information below. Give it a thumbs up, subscribe. Health and light. Bye.